Now, as of today, Diepsloot residents will enjoy advanced and quality primary health care. A non-profit organisation, Rhiza Babuyile, has launched its R5 million first brick-and-mortar clinic in the area. Residents there are expected to pay as little as R100 for services at the clinic. For more on the state-of-the-art clinic, I'm joined by Rodney Makube, who is the Chief Operating Officer of Rhiza Babuyile. Rodney, very good afternoon. Thanks so much for speaking to us. I suppose it's absolutely important to say congratulations on this magnificent development that's occurred. What has inspired it?
Good afternoon to you and to your listeners, and thanks for the congratulations.
Well, I know that your history in this area dates back 10 years where you have mobile clinics. Why have you upgraded from mobile clinics to brick and mortar?
So, yes, we have been operating from mobile clinics for quite some time, but mobile clinics have got limitation in terms of number of patients you can see, but also making sure that your patients are protected and safe during harsh weathers, whether you've got rains, whether you've got cold winters. So we took that into consideration to grow into a brick-and-mortar clinic.
I'm glad you talk about the consideration. After 10 years of being in Diepsloot, I'm sure there are other key learnings that you've come up with. Would you care to share some of these?
Yeah, so I think some of the learnings that I can share with your listeners. Firstly, we became well aware that there are a lot of mothers, because we do a lot of pre- and postnatal care. Maybe if I pay more attention on that one. That you've got a lot of parents who would like to go to work and quickly run to a clinic and run back to work, or run to a clinic and go to work. So from time management point of view, in Diepsloot, you've got quite a high number of entrepreneurs, people who are running their own businesses, who wouldn't necessarily want to take a day off to be in a clinic, to take a child for immunization. They would like to quickly go see a nurse and get back to do their business to earn their income. That's one of the things that we have seen. The second issue, as I mentioned, we realized that we've got a very, very heavy rains. We had a shelter, like a waiting, almost that looks like a carport, but that does not really protect people when we have got the real harsh weathers. So we wanted to make sure that we communicate value to the people of Diepsloot. We value them as a community and also as customers of the service that we are rendering as an NGO. So I think from that point of view, it propelled us. And the support, by the way, that they are giving us. I mean, in a month in Diepsloot, we are able to service between 1,300 to 1,500 people in a month. So obviously the population is growing, the need is growing, so you would want to respond to that need. And with the present economic situation, you wouldn't want to see people getting into a taxi and going to far areas just to get medical care. So we also are considerate for points such as those that I've mentioned.
Now, one of the things that's been evident in the many conversations we've had with various caregivers is that a lot of patients are complaining about how they're treated by nurses when they go to clinics and they go to hospitals. Is it something that you've observed and something that is key in your service delivery protocols?
Yeah, look, actually, that's what we sell. If we should say, what is that people are paying for? You spoke about a minimum of 100 rands. What is that thing that they are paying for? For us, they are paying for customer experience, right? I already spoke about the issue of time. You know, it's in our culture that waiting must be shortened as much as possible. The second issue is you must experience that a nurse is someone you can talk to. By the way, when people come for medical care or medical consultation, they are going through far more than what they are presenting. But it all depends on the reception that they get, that they can explore more. You can imagine if you've got a 15-year-old young girl who's pregnant, unwanted pregnancy, or who is already sexually active, who want to talk about contraceptives. If you go to a clinic, you want to find someone that is welcoming. You want to find someone who's ready to have a conversation. You want to find someone who's willing to give you medical advice. You want to be in an environment where you can explore more. if you cannot explore more, you will most probably swallow some of your questions and concerns about the very same health that you came to address. So for us, we are selling customer experience as an NGO. We want people to feel like I'm respected, I'm valued, I'm important, I'm listened to. And that's why the type of the clinic we have built. I think that clinic, I mean, if you build a nice house, you are building it for yourself. But as an organization, building such type of a clinic communicates value. And it's not just in the building, it's in how our staff treats our patients.
Now, Rodney, you raise the issue as an example of a young girl, possibly 15, coming into the facility with an unwanted pregnancy. Now, it obviously puts into context the issues that we are struggling with as a country around gender-based violence, and that some of these pregnancies may be a result of rape. What are the conversations that your staff have when an underage individual comes in seeking assistance, whether it's pregnancy termination or is pregnant and needs some form of advice?
How we have structured the clinic, you've got the medical staff inside the clinic, and you also have what we call community health care workers. These are young people that are trained to communicate issues of health within the community, who are available to reach out to the schools, to the churches, and they are also doing door-to-door. And part of the programs that we have focused on very strongly, especially before COVID, was the issue of family planning. And that was to communicate to young people that this is something that can be planned, and there are medical ways that you can plan pregnancy, you can plan having a family, so that we don't end up with unwanted pregnancies. But given the point that you have raised, for example, should it happen, so as a clinic ourselves, we do not offer like pregnancy termination, legal pregnancy termination services. We do referrals. We do have a social auxiliary worker who's employed at the clinic to offer counseling. So then young people can receive counseling, they can receive support, but that is something that we refer to government institutions since we are not resourced to offer such a service.
Now, your establishment is number 3 in the way of healthcare, apart from the 2 government establishments that are in Diepsloot, and you're servicing 300,000 residents of Diepsloot. Now, you talked about 1,300 to 1,500 patients that come through your doors. Do you have capacity for more? Are these numbers the optimum numbers that you're able to deal with?
This is a minimum we can do, right? I'm bearing in mind that we are coming from a mobile. And time and again, you will have disturbances with mobile. Sometimes you will have demand in certain areas. Then you will have to plug out a mobile and go and service somewhere where there is a crisis. Like at the present moment, as Rhiza Babuyile, we are working in partnership with the government of KwaZulu-Natal to relieve with flood reliefs, and we are giving healthcare services. And that meant you have to plug out a mobile or 2 to go and support. So those things do happen. Even with COVID, they do happen. So that leaves you with minimum you can reach. Now, with an establishment that we have, we are saying our minimum is 2,000 with that establishment. So we can go far beyond that. We have established, our mobiles were giving us, for primary health care, they were giving us about 3 consulting rooms and 1 consulting room for dental services. With this establishment, we will go as far as about 7 consulting rooms for primary health care services, you see. So it's almost, we have more than doubled our capacity. So we should be able to go far more than 2,000 from service point of view.
Now, I understand that on the cards are emergency room services that you'll be looking to offer. Talk to us about your plans for expansion.
Yes, so we are calling that our phase 3 in terms of our growth. Obviously, we are studying, and we have been studying what is happening in Diepsloot, what type of response is available in case people have an emergency, and who are the role players in that area. So we have built an emergency room. We are busy resourcing an emergency room. The next step is to begin to create partnerships with the role players within that space. Just to make sure, we believe, as Rhiza Babuyile, we believe that we must not reinvent the wheel. Collaboration is key. So we need to be sure who's there and who's really rendering quality services. So we collaborate, and we believe in also in collaboration with the government. So that's the next thing that we are working on, looking as who's the best partner that we can collaborate with, just to make sure that where there are emergencies within Diepsloot, people don't have to wait for too long and travel too long to get a proper service, but at least there can be something in the vicinity that can respond to emergencies coming from the community.
And finally, Rodney, what is your relationship with the Gauteng Department of Health as the custodians of health in this province?
I'm glad to say that maybe tracking back to national, that we have been recognized by the national department as a partner in health, which is great. And with the Department of Health in Gauteng, we've got relationships with them. We actually, starting with during COVID, we were in partnership with the department, assisting them with vaccinations. Not only in Gauteng, we have done that in KwaZulu-Natal, we have done that in Cape Town, in Western Cape. So we have been in partnership with different departments to make sure that we respond to a need at that time. In KwaZulu-Natal, we are in partnerships, especially when it comes to extended program for immunizations. So we partner with them in immunizing children. You can imagine that immunization is one of the biggest things for primary health care, because when children are immunized, obviously they are prevented from having some of opportunistic illnesses or infections, and they can lead healthy lives, both as children and as adults. So our relationship in such a way that we do get vaccinations from immunization point of view from the government, and we immunize and we send them statistics. So we extend what they are doing from immunization point of view. And we are busy working on a program of partnering with Gauteng Department of Health, even when it comes to dental, because even dental services, they are really not that much accessible. So we're working on an agreement, as I'm speaking to you now, with the department in Gauteng to extend the dental services. So, yeah, those are our partnerships.
Rodney Makuba, we thank you for your time this afternoon on Newsfeed, the PM edition. And he's the Chief Operating Officer of Rhiza Babuyile. And they've been in the Diepsloot area for the last 10 years, running mobile clinics. And they've recently opened a 5 million rand brick and mortar facility that will look to service the 300,000 or so residents of Diepsloot.